Have you ever had a long-term friendship or someone who you've been friends with most of your life, or one of your friends was diagnosed with multiple sclerosis or any long-term illness for that matter? Well, today we're going to talk to my friend Karen, and we've been friends almost half of our lives. Right?
Yeah, actually.
Half of our lives.
Without telling our age.
Literally, without telling our age.
Yeah.
But yeah, we're gonna just talk and just kind of explain how we've done this since I've been diagnosed with MS. So, first question, since we're gonna ask questions.
Okay.
What was I like as a student when we first met before pharmacy school? Well, actually in pharmacy school.
Yeah.
What was I like? What was it like when we first met?
You were very studious, very kind, and my first real memory of you, besides just sitting in the classroom, was we were in what I'm going to call the union, the student center, and several of us had not gone to that university. We were sitting together, recognized each other from class. You walked over and introduced yourself. As friendly as you are today, that's how you were that day. And that's my memory of meeting Michelle.
Really?
That's my memory. And that's when I asked you what church did you go to, because I could just tell you were a Christian. I could tell, and I knew that I needed to go to church. I was away from home, and I didn't feel right not being in church on Sunday, so boom, I had to ask you, because I knew the way you approached, the way you spoke to us, the smile that you're wearing now, it was all there. It was all there. So my first memories of you are kindness, love, showing yourself friendly.
Oh,
that's what I remember.
Well, thank you.
You're welcome. It's just the truth.
By the way, we've been friends almost 30 years.
Long time.
And we still laugh like
We
this.
still giggle like there's nothing else to do all day.
Oh, back to
we're gonna do this.
Sorry, serious face. Okay. When you moved to the same state that I lived in, we became a part of each other's lives even more.
Yes.
Because, by the way, we used to have so much fun when we were in pharmacy school. Yes, we studied.
Oh yeah.
We got around to that.
We got it done.
We got around to that, but we laughed a whole lot.
We did.
And
let's go. Take one.
Okay.
I'm sorry. I'm trying not to. We good.
And so we decided to keep it going because whenever I graduated, you were still in pharmacy school, and I called and asked, would you consider moving up here where I am so I don't have to be by myself? And you were like, sure.
My first
No.
No.
Why would you ask me that?
No. And my husband was willing. He was willing. And I was like, no, I want to go back home. I want to go back to my people. I want to go back home. And one day the Holy Spirit really did, just out the blue, say it was not a question. It wasn't even on my heart at the time. I was walking, praising the Lord, going to get the mail, and was just complimenting him on all of his beauty, what he has done with the sky and everything. And it came to me twice as I kind of scared me, and I just, jumped. Whoa. It kept going, and then it came again. So I was like, I ran and got the mail and ran back to the apartment. I was like terrified. And I told my husband later that day, and he said, I was waiting for him to tell you because you weren't listening to me. I was waiting for him to tell you. Yeah.
Good move.
It works.
Good move.
The Lord
Speak. All
So
right.
that's when I was like, yeah. And he waited. But he knew the Lord would tell me. And
You did it. All right.
And he did.
Yay for me. Okay. Can you recall the day? Because we do live in the same town. Can you recall the day when I called you and told you that I was in the hospital?
What I do remember was feeling a sense of urgency, feeling scared, feeling confused. What's going on? What's going on? And why? How? Where is this coming from? What? I remember that. And I remember we got to the hospital. I remember what I was wearing. That part is just that vivid.
Really?
Yeah. And I just remember feeling a little helpless. Like, what can I do? What's going on? Why are you here? I remember that confused feeling and some fear. Because, I mean, you were young, married. What just happened? That I remember. I don't remember the words. I just remember basically feeling derailed after that.
Yeah.
And just trying to get there. What can I do?
Right.
That's my memory of it.
Gotcha. Sometimes, once I told you that I had been diagnosed with multiple sclerosis, did you, just thinking back, do you remember me showing any signs or symptoms before my diagnosis, or was it after my diagnosis I showed signs and symptoms?
I don't remember signs or symptoms prior to that. Okay. There was nothing that stood out or anything that I thought was off from what I had known.
Okay. Okay. What about now? What do you notice now?
Physically, of course, I see when you're not feeling well. You may not say it, but I can kind of see that look of, I'm trying, or I'm getting through this, or I'm determined, because you are stubborn in a very good way. Stubborn. And I can see when you are pushing yourself. And of course, I'm not going to stop because I want you to keep being stubborn. Please push yourself. But I can kind of see sometimes when, I'm tired. I can see that shows up for me. Maybe quicker than pain. You usually tell me about any pain you may be feeling. You usually say that out loud. But I can sometimes see you're pushing yourself and you're tired, but you're like, I'm gonna do this. I'm gonna finish this.
Well, what would you? I'm sorry.
Go ahead. No.
What would you say to other friends of MS patients who do see when the fatigue sets in or when they are being stubborn? How do you balance being a friend who wants to help, step in and help, versus allowing your friend who does have MS to push harder to accomplish what they want to accomplish? How do you balance that?
Sometimes I have to be quiet. Let you say it, let you do it, wait for you to say help.
Because I do.
You do, and I'm grateful. So sometimes I have to just let you be, because you're still Michelle. Yeah. So I have to wait for you to decide. This is where I need to say, hey, help. Okay. Other times, if it's something you're talking about, maybe not necessarily physically doing yet, I can try to just give my opinion, because usually you listen or you will ask for my opinion. So I will definitely share it. So I just recommend for others, if you know that person, then you definitely work with them the way that you know you should work with them. If they need to just talk it out, if they need to vent, if they need to get out, let's go get ice cream, let's just hang out, make yourself available, be flexible. And be patient, because sometimes I do just want to say, give me that. Let me do it. but you do that to me as well. And so I have to not try to give you special treatment. I guess this is what I'm trying to say.
Yes.
You are Michelle, you are very capable, and I just have to get out the way and not try to stop you from being stubborn.
Right.
Be
Right.
stubborn.
I understand.
I just gotta move sloot over and let you be, and when you say I'm ready for some help. Okay.
That's fair. That's very fair. And that's very wise. Because as the patient, something I've had to learn since I've had multiple sclerosis is I have to ask for help and be okay with that.
Yes.
The days of pride are over. The days of I got it are over. The days are I can handle it are over. You have to allow your friends to be your friends. You have to allow people to love you well. You can't do this by yourself. You cannot do this by yourself. And you do give me freedom to, like, no, I'm going to do this. I'm falling, but I'm going to do, no, you do, you give me freedom to do that. And I appreciate that. But at the same time, like you can see.
Yeah.
I mean, and a lot of it isn't just getting to know somebody. You've known me for years, so you can tell when my facial expressions change, or when I'm saying something without saying something actually.
Yes.
So yeah, but yeah, just making yourself available to your friends is
a big deal.
Is a big deal. By the way, we've been together most of today, and we've had everything but this. Because we've been laughing all day.
Great day.
It's been a great day. It's been a great day. Let me ask you this. Do you think I see or saw myself defeated once I was diagnosed?
I think in the beginning, yeah, a little wobbly, but determined. And I think further along, you hit a point where I could see you signing off. That's right. You would hug my children like there was no tomorrow. You wanted to take pictures, which is fine, but it was almost like you were saying, don't forget me. That was tough. It was very tough. It was obvious to me what you were doing, because you would just watch them do stuff, or you watch someone else doing things, but it was with that look of, I miss this. And I couldn't stand it. So at just one point I did tell you, may not remember, because I don't think I said it with the conviction I was feeling, but I told you to stop, that you weren't going anywhere. We can take pictures, but not for that reason. Not for that reason. So I had to little spank, little pushback to try to get you to stop with the poor me. You weren't saying it, but I saw it in your face, in your actions. Really? And so that one picture that I'm remembering, I took that one to work with me, and every office I had at work was my husband, my children, one of my nephews, I don't know how he slipped in there, and you. And it was you with my children when you were doing that hug thing, and it would just remind me to just pray for you throughout the day. And so you were always on the wall. And so now that I don't work in an office, you're still in the office where I do work, but it was my reminder to just keep lifting you up in hopes that you would not get into that poor me and get stuck. I mean, I know you have to vent. You have to go through different phases. You have good days and bad days like everyone else, but I didn't want you to get stuck mentally, because that's the battleground. You needed to be fierce in the mind.
Wow.
You stop.
I'm
You
sorry.
Stop. You stop. Well, yes, there was that phase, and
Was it early in my diagnosis?
Yeah.
Or?
it was early enough. I had both children by then.
Yes, it was early. And early
So
enough.
still early.
Yeah, like the first third.
Mm-hmm.
Okay. Are there any words of wisdom you can give to friends of those newly or not so newly diagnosed with multiple sclerosis?
Yes. Giving that friend time to adjust mentally. I want to use the stages of grief. You kind of go through the shock, you go through the anger, you're in denial about something. There's a lot to process, and just being supportive, not denying that there's a lot to process or denying that this is where we are, but also uplifting. Like, it doesn't mean this is, a pink slip. It's a challenge. And you have always handled challenges well. And even trying to help that person have a different spin on it. You think of Paul, that thorn in his side. He didn't stop preaching. He was stuck in jail. He didn't stop preaching. 2/3 of the New Testament. I bet you he did it behind the walls of, the walls of a jail cell. So just knowing that you may have the challenge, but let's think, how do we get through this? How do we still have a life? How do we still do things? And so just being supportive in that way. I never wanted to baby you, even if I wanted to, because I didn't want to make you weak. I didn't want to mentally shut you down.
Because you do that on your own. You do that on your own as an MS patient, because there are very, very, very dark days where you literally want to sign out. You literally want to not throw in the towel. You just don't feel worthy any longer. When that's not true.
It's not true.
That's not true. So having a friend that can speak life into you, that can pray for you when you don't know you're being prayed for, that can remember who you were before the diagnosis came, is crucial. Somebody who remembers who you are outside of MS, and then once you are diagnosed with MS, can help you remember who you are and remind you who you are, because it can become a distant memory sometimes. It can become that person over there. Remember when I was like that?
Right.
You still are like that.
You still are.
You still are like that. You just have a diagnosis.
That's right.
That you have to
and many of us do.
Right. You have to navigate. Right.
You got to figure it out. You have to adjust.
Exactly. You have to adjust. It's not the end of anything.
No.
Matter of fact, it's the beginning of a whole new perspective of life.
You had a lot of beginnings.
A lot of beginnings.
A lot of breakthroughs. A lot of accomplishments.
Since then.
Yes, you have.
Since then. So.
And I think that friend also needs to be a little stubborn, just like the one with the diagnosis. And I'm going to use this as an example. There will be times where we would say, let's go get ice cream, let's go get coffee, or let's go wherever. And you might even drive to my home and then say, you drive. Like, no. No. You drive. You drive over here. You drive. So
no,
just you drive. No. So just again, not babying, but I know you're capable.
You're capable.
Come on, let's go.
Let's do it.
And also finding ways to keep them engaged in thinking about other things. Like, I need to go to Target. I need you to come with me.
Right.
I need placemats. I need you to help me find some.
Exactly.
So let's go.
Let's go.
Let's do girly stuff.
Right.
Yeah.
Participate
Let's not
in life.
just sit down right here and.
Exactly.
I mean, not that that's a bad thing. We could
Right.
sit and talk and Google all day.
Right.
But yeah, let's make some memories. Let's go do something.
And that should be a priority. Making memories.
Mm-hmm.
Still living your life. Still enjoying your life.
Absolutely.
Still being a part of your own life. That's
Yes.
something that a friend does, is help you still live in your own narrative
Yes.
and not on the sidelines of your own narrative.
Agreed.
So yes, I totally agree with that. And thank you for that.
You're welcome.
What do you say when you don't know what to say to support?
That's a good one. That's another occasion to sometimes just listen, pray, and wait, because giving wrong advice could really just mess up wherever you are, wherever your friend may be mentally. So sometimes the answer to me might show up later. If it doesn't show up right then and there, then I'm listening.
Mm-hmm.
I'm supporting you. I'm mad with you. Whatever it is.
Right.
I'm with you
Right.
until I get a sense of something else. So a lot of times, I think being an ear or even just an active listener,
Mm-hmm. An active listener.
just not necessarily just being silent, but letting you know I hear you
Mm-hmm.
and I understand what you're saying.
Right.
I'm not just nodding, but I can feel it.
Right.
I think that's important.
I agree. Excuse me. I agree with you. And I also think that it's the responsibility of the person with MS. Yes, you are the one going through
Mm-hmm.
the disease. You are the one that is, air quote, suffering.
Yeah.
But it's vital that you try to articulate
Mm-hmm.
the best way you can what's actually happening,
Yeah.
so that your support system can actually support you.
I agree.
Or try to learn a vocabulary where you can say where you are,
Mm-hmm.
where you are physically, where you are mentally, because sometimes they may pick up on clues about you, but they may not.
That's right.
And so being able to say, right now I'm in a really hard place. Can you just sit with me?
Yes.
Sometimes just being able to say that
Mm-hmm.
is plenty.
Yeah, because you can get a response.
Because
Absolutely.
you want to be a friend.
Drop it off.
Right.
Grab the laptop.
Right.
I'm coming over.
Exactly.
Yeah. I just
Actually,
need to know.
remember when that happened? When I was taking a new med
Yes.
one time, and I called, and we live around the corner from each other now. I called and I was like, can you just come sit with me while I take this new drug?
Yes.
I don't need you to talk to me. I don't need you to give it to me. I just need you to be here.
Yes.
And you came over and you worked. I took the med and I went to sleep.
Mm-hmm.
And that was it. That was literally it.
No, yeah. If that's what you needed, that's easy enough.
Right. But it was a two-way situation. I had to ask,
That's right.
and you said absolutely. So that's what friendship is. It's two-way. Two-way. So
Don't shut each other out.
right, don't shut each other out. And you know how we as a society speak of emotional intelligence. Well, having a chronic disease, being able to have, once you've gotten over the grief and the fact that you're paralyzed by what's happened to you, not physically paralyzed, but you're stuck where you are, learning how to articulate what you need
Yes.
is very important. It's very important
It is.
to everyone around you, to your parents, to your friends, to your spouse, if you have a spouse, to your to your clergy, to your God. It's very important to be able to give a vocabulary to what you're feeling,
because you can read about it all day, but when you know someone who has it, it's almost like you go blank mentally, because you're kind of like, okay, what do you need? What's going on? What are you feeling?
Right.
So even if you have an idea of how progression happens, it's different when it's personal.
It's very different.
It's different. And when you're feeling something, I mean, I don't know unless you tell me. I don't know that the heat is just totally not working for you unless you tell me that. You know, even if I learned it in school, it's almost like, but this is a living example. Okay, now it makes more sense what's going on. It's a different game.
Exactly.
It's a different game.
Isn't it weird how we went to pharmacy school together, but now that we've lived through this together, how things on the page seem to have become three-dimensional.
Yeah, jumping off.
They're jumping off the page. But I'm sorry, I didn't mean to interrupt you.
No. I was just gonna say you have always done a great job explaining your status, which I always appreciate. I didn't have to guess. Had an appointment? Are you coming with me? You know, just however you wanted to share. You kept me informed. This is what happened. This is what I'm doing now. This is what I'm trying now. And it just helped me to be able to relate and to help wherever I could. Whether it's, like I said, just over there praying, or if you needed a touch point, or if you just needed to get out, or you know, you kind of helped me in the loop, which I think is so crucial, so that if I saw something, if I saw a shift, I didn't have to wonder for very long what happened, because that would happen, and you would, I don't know if my face told the story or what, but you would pretty quickly say, this is what happened. Okay, we're good? Okay, all right, you know. I just needed to know and not have to guess or go into an internal panic.
Right.
So you were always willingly sharing, and that to me was important.
Thank you. I appreciate that, because I never thought about it. I've always been pretty chatty. I've always
But
been
you know, you could have just shut down with this part of your life.
Yeah.
You could have.
I could have. Yeah. Because let's be clear, there is a tremendous amount of shame that goes with being one day normal, and within a very short amount of time, for some is over the course of years, being completely functionally different.
Yeah.
There's shame that goes with that. So, and it takes a real friendship. I mean, I happen to have a great family and great friends, great husband. So I feel free to share how I feel, but everybody doesn't have that.
Yes.
Where they feel free to share. But I would like to encourage you to find someone that you can be honest with.
Yes.
Your physician or doctor, however you call it, your roommate, your co-worker, your family,
support groups are
your
out there.
support groups that are out there. Find someone that you can be candid with, someone that you can share your journey with, because you need it.
Yes.
You can't do this by yourself. I mean, I'm a living witness. You can't do this by yourself. So if you are in a place in your MS journey where you are a friend of an MS patient, or you're actually the MS patient, write down in the comments things that you do to make your friendship work, or things that you've done to support your friend with MS, or things that you as the patient with MS that you've done to help your friend understand what's happening with you. I love to read what you guys talk about. And again, thank you so much for watching. And please feel free to like, comment, and subscribe and share so that everybody who watches this video can learn how to be a better friend of an MS patient. Thank you very much.
Thanks.